Hello, listeners, Fascial Stretch Therapy family, and others who may be interested in everything associated maybe with pregnancy, birthing, and maybe the issues or challenges, I should say, surrounding that time of life for the mother as well as the child, and even for the family. And I'm so excited to be here with one of my students, graduates, Hilary Boucher, level two fascial stretch therapist practitioner up in Ontario. Um, we'll give you our contact information a bit towards the end, but for now, I want to get going. This is exciting stuff I want to ask you. I'm going to grill you about midwifery, if you say it that way, doula-ism, being a doula. I don't even know the terms. You have to
Doula-ing.
doula-ing, yeah. So without further ado, Hilary, take it away. Please introduce yourself and where are you and all that.
Yeah, okay. Well, yeah, I'm in Toronto, Ontario. That's where I practice. And my background is in personal training and fascial stretch therapy, structural integration, and birth and postpartum doula work. I'm full spectrum trained, so I'm trained in fertility as well, but I choose to practice postpartum and birth just because that's my passion around the body.
Yeah, that's a real unique skill set. I think I had one other person actually who she said she was a doula, and I knew the basics, and that's all. I didn't really get to talk to her too much about that. She's the only one else that is a fascial stretch therapist that I know of. So, without any further delay, let's just get right to what is the difference between like a midwife and a doula. To me, is the question I always want to ask.
Yeah, it's a really common question. So a midwife is really there. They can be an alternative to your OBGYN. And really they are your healthcare provider for your birth. So they do all the clinical work. So they do your prenatal appointments with your blood pressure, and they're there in labor and they deliver the baby. They can deliver your baby really wherever you choose to birth, whether it's at home, if you want to have a home birth, or a birth center birth, or a hospital birth, they can also deliver there. And so a doula is kind of a different role in that team. So a doula is really an outside person that's hired by a birther or a birther and birth partner. And we're really there to support them. So we don't do any of the clinical work. Our role is more in support. So we can offer kind of three categories of support. One of them being emotional support. So
Mhm.
particularly if you're having a different birth experience, like you had a C-section prior and now you want to have a vaginal delivery, um, all different types of scenarios. If it's your first birth, if you're having multiples, there's all different kinds of unknowns that can come up in birth. So in terms of emotional support, we're really there to kind of be unbiased, non-judgmental person that they can speak to about their concerns. We have a resource, so we can connect them with other people within our network that can help them with those concerns. Um, so we also offer physical support. So that can be in labor. So for example, doing, they're called hip squeezes, where when the birther, is having a contraction, you can press into their pelvis and work with the contraction to help their pelvis open and bring the baby down.
Wow.
Um, yeah, so kind of just like little techniques that you can do. You can uh, offer them different positions that they can labor in. So we often think that birthers labor just on their back, but there's lots of different positions you can labor in. Squatting, for example, if you can squat, is really great because you're working with gravity. So we can offer, if they're not hooked up to monitors or machines, we can offer them different positions like that.
Perfect.
And yeah, also we can get the birth partner involved. So sometimes, the partner is kind of like, what do I
Yeah,
do?
yeah.
And we can just kind of offer them suggestions and kind of get more partner involvement. So it really can create a more intimate, safe, positive birth experience for all involved. And then thirdly, we offer them informational support. So um, depending, they might not know what some of the tests they're doing or what the lingo means around
Sure.
what their doctors are talking about, and they might have concerns about that, or they might want to know more about that. They might want to know what their options are. So do they have to go forward with this test, or do they have a choice to go forward with this test?
Sure.
What happens if I go forward with this test? So we're there to kind of say, these are your different options. These are the risks, these are the benefits, and then we're there to really just support whatever choices they make, so we don't influence their decision in any way.
That's perfect. Well, thank you for that introduction. That I know a little bit more now. And I guess that leads to the next question. Since a lot of the listeners are going to be colleagues of yours in fascial stretch therapy, and they're medical people, they're fitness people, a nice mix of people. Most of the questions I get are questions surrounding the pregnancy to start. So during, the trimester periods, the first, second, third, they always want to know, what can I do? What am I allowed to do? What am I not to do? What positions can the person be in on the table if they're being, if they experience assisted stretching of any kind? Do you have any guidelines for maybe each trimester, or, something along the lines that would help people to know how to safely take care of people that say they feel they have some aches, they have some pains. That's why they're seeing a fascial stretch therapist, maybe to augment some of the training. One of our teachers is pregnant right now, and she was, in her previous pregnancy, she actually did a lot of strength training. Like, I'm talking some deadlifts and things like that. So anyway, I'd like to know general guidelines, obviously, if you have any.
Yeah. I mean, when it comes to moving into a pregnancy, I think really some of the best work can be done actually pre-pregnancy. So if
Right.
this pregnancy is a planned pregnancy and you're working with a client that is planning to get pregnant, anything you do pre-pregnancy is going to make way more benefits than what you would do in pregnancy. Because
That's
in
smart.
pregnancy, yeah, and in pregnancy, you're a lot more limited in terms of like what you said with positions and things you can do. There's more risks. So, I mean, that being said, anything you can do prior to the pregnancy would be certainly ideal.
Well, let's take two examples. You'll have a fit person who's doing, let's say, all the right things, where she's preparing the body well, she's eating well, and all that kind of stuff. She's fit, she's healthy. Well, and then we'll talk about the opposite, the unhealthy
Okay.
woman who goes into pregnancy and clearly doesn't have strength, has been sitting on her job, gets pregnant, and really didn't do anything to prepare. Take those two case scenarios because they're both common. So the fit person, what would you do if they still experience some imbalances due to the growth of the obviously of the child and their body's changing? What kind of guidelines do we have as fascial stretch therapists and trainers to help these people feel better?
Yeah. So, I think it's fair to say that in pregnancy, discomfort is pretty straight common.
Okay.
You are, your abdomen is changing, your body's changing, your hormones are changing, and you really can't predict how the pregnancy is going to go. Even if you've had, four pregnancies before that were all, really straightforward pregnancies with no complications, you just never really know.
Oh, okay.
So there isn't really anything that you can kind of cluster together in terms of like what would be best for this person and what wouldn't be best for this person, because there's no real black and white.
Well, they generally have low back pain.
Yeah, exactly. So
So they want relief,
yeah,
right? And so people like fascial stretch therapy, can I traction them okay? Because just decompressing the back, you're lifting their legs, they're in supine on their back, you lift their legs up only 20, 30 degrees, and you lean back. Just two leg traction seems to relieve so many people. Just something simple like that. Is that something
absolutely,
safe?
absolutely, yeah. So their body's experiencing tension, right? Because it's trying to hold with all the changes.
Right.
So I find with pregnant individuals, less is really more.
Okay.
Half the amount of work that you would do with someone that's not pregnant, you would do about half that with somebody that is pregnant.
And what's the reason? Because you don't know if that's going to what, be a negative?
Well, just because they're much more sensitive. They're because their bodies are producing relaxin, so that hormone that makes everything so lax and loose.
Hmm?
Their bodies are kind of in a natural state of flux.
Does
So
that,
there's
does that, pardon me, I'm going to jump in. Do you mind if I just jump in? Because
no, not at all.
we're so relaxing. I heard of it. I know about that. I don't know what stage. I mean, it's always being released from the first trimester all the way to the end, or, you start thinking they tend to be more hypermobile in the second and definitely third trimester, not as much as hypermobile in the beginning, but am I wrong?
Um, Again, I don't know if there's really a straight answer to that. I think
Hmm.
it really depends on the body. I think it depends on also the quality of the tissue. You know, if somebody is more collagenous versus more
That's a
elastin, and
really good point. That's a really good point because we don't think that way. We always like hard and fast protocols, and it's not. If they come in having a hypermobile body, like I'm hypermobile, if I was a female, I would get pregnant. I may have some serious issues because I already start that way genetically.
totally, totally, yeah, exactly.
So it's good
Um,
to know that, right? It's really good to know that.
Yeah, exactly. So it's really good to, I think as an FST practitioner, if you're taking a client that you've been seeing and you kind of have a sense of their body and you know their body before pregnancy and you know they're hypermobile or you know that they're more collagenous and they have a lot of limited range of motion restrictions, you
Right.
can kind of gauge what you're going to do with them as they get pregnant, just keeping in mind that they're going to be more mobile. So
So,
if somebody's already predisposed to that,
mhm.
then a lot less work can go a really long way.
You're giving me an idea. Like, for instance, I think people like you and others, if they want to work with people who get pregnant, you can almost put down, you know how you do before people get married, they kind of do a fitness, fitness clubs put out like, get ready to fit in your marriage, into your dress, your wedding dress, and looking good for the pictures and this whole thing, right?
Yeah.
Well, why don't you do the same thing for pregnancy? It's like we are going to take pictures, but when the kids pop out. But I'm thinking more about health, right? Why can't we all do pre-pregnancy screening? There's people who are in various stages of either planning or unplanned pregnancies, right? But if you know you're going to have a kid, you're planning on it, you're not pregnant yet, why can't we encourage and put it out there almost in marketing? If you're planning on getting pregnant, come in and get screened so you can have the best pregnancy possible. And
Absolutely.
if you're hypermobile, we're going to stabilize the heck out of your body so that by the time you get the relaxin pumping through your body, you're just that more stable and have less problems.
Absolutely. And
'Cause-
I can attest to that. I worked, one woman in particular comes to mind. So um, she had had her second baby. And after her second baby, she came to see me in the postpartum period. And, that period is a really great time to actually receive body work because your body is kind of tapering off that relaxin after having a baby. So the good like 6 to 8 week general guideline of healing at home is a good idea, especially getting clearance from your healthcare provider. But once you're cleared to start, mobilizing your body, stretching your body, gentle workouts, all that kind of stuff, it's a great time to go receive body work because, your body has been adjusting to something that's for 9 months and all of a sudden it's not there and it can feel really disorganized and vulnerable. And that's when a lot of long-term chronic pain can kind of come from.
Yeah, let me hold off for 1 sec. I'm going to follow that. I just
Yeah.
want to say to the listeners now, because there's a lot of information coming out now, and I want to make sure I got it right so they got it right. So let's just real quick summary. If you're coming in before you're pregnant, it's something that fascial stretch therapists and others in training in fitness and therapy can see people and address imbalances and issues of being too mobile, hypermobile, and stabilize your system, your neuromuscular system, your neuromyofascial system. And for those who are the opposite, very collagenous, so very stiff and tight, we can get them much more mobile so that the whole process will be easier. Is that correct in general?
Absolutely.
And
Yeah.
now we're going to talk about postpartum, let's say, and then I want to get back to trimester time. But
Okay.
postpartum is a really good time to see clients. And then you said it's good to follow the 6 to 8 week healing for general soft tissue. Uh,
Yeah,
you know,
depending on what kind of birth experience you've had. So, like a C-section has a little bit longer, more extensive healing process than a vaginal delivery, for example. Some women, 7 days after giving birth vaginally, they're like cleaning the house, up, walking around, they feel great.
yeah.
Some women really need that time to heal. So, again, I think it really just depends on how much your body has to shift and how well it tries to come back after all that.
Well,
Um,
there are people who come back, like you said. I heard of this. They were fine before pregnancy. They were pregnant, and now they're not fine, and it's like a year later, and something's like off in their body.
yeah.
And I've always looked at it different ways. When you get to the point where you're carrying your kid around a lot, like some women do, on that one favorite hip, now they're off kilter and it throws everything off, right? And they always pick the same hip, a lot of women.
Yeah,
And then as the kid gets heavier and heavier, it becomes more of a leverage issue, pulling them out of a crib or whatever they're sleeping in. And then that could transfer into strain on their back, you know,
absolutely.
because
Yeah, and
they're reaching.
even breastfeeding, sometimes, breastfeeding can be a really big challenge. So, sometimes when you get your baby in the right position and your baby's feeding, you're kind of just sitting there. And, sometimes it's
Women,
like, well,
women don't think, not women, people don't think about that. Like they'll sit at a computer all day and they really don't know unless they read something that's bad. They don't really know. And so I think it's the same thing surrounding the birthing, the excitement of the child, and you do what you have to do, right? You love the child, you want to take care of the kid, but you kind of sacrifice your body. You don't think about the imbalances that are feeding in. I think if we had pamphlets that literally showed a picture, do you look like this? Are you carrying a kid like this all the time? Are you, you know what I mean?
yep.
Is something we could have in our clinic or office for those clientele to show them. They're when they look at it, it's like, oh my God, yeah, you're right. I'm always carrying the child on the hip. Maybe I should switch when I can. You can't always.
Yeah, yeah.
Things like that can be very educational and prevent
Absolutely.
problems.
Yeah, and like I know, one of the things that really uh, came into my awareness when I was studying as a doula was the postpartum period, because so many of us focus on the birth and the labor, and the
Right.
labor is really just like 1 day, maybe 2 days. But the postpartum period is a long time after that. And they
Really,
say,
how long is postpartum? I know postpartum can be forever, but what is really postpartum? How long?
well, I would say like 8 weeks is
Oh, okay.
really postpartum period. But again, depending on how you're healing, um, I don't know if there's really a set cutoff on
So,
that.
so postpartum really means it's a phase of healing. Okay. Now this is something new for me. It's really the time period as you're the birther, you give birth, and it starts at that point, and it ends at a point where you feel like you're back to the way you were before you got pregnant.
I would say that's fair. You know, I would say it's also relative, but yeah, I would say that. So the
8 weeks.
postpartum period is really like we're assimilating, and there's also, the fourth trimester with the baby, where the baby's kind of assimilating to being outside of the womb. So I would say it's fair to say, even like 3 months. Sometimes it takes a good year to assimilate after having a baby. Like I said, I don't know if there's really a cutoff point, and
Yeah.
I think in terms of postpartum, what you were saying about having pamphlets and things like that, I think it would be really valuable if you're working with a pregnant client to actually get something if they know their estimated due date. Planning a couple of months after their estimated due date, to even have like a follow-up appointment,
Yeah. This is fantastic.
sometimes a really great idea,
Yeah.
because birthers are really designed to, like what you said, to think only about their baby. And it really is a chemical change that goes on in their brain. So we're designed based in survival and primally to think only about our baby, and we really neglect ourselves. And so setting up that appointment, just that initial appointment to check in, see how they're healing, see how their body's doing, and then maybe getting a postpartum plan set up for care can be invaluable to a mother that is with a brand new baby and doesn't know how to take care of themselves.
Well, that's so much new information that I just have all these ideas in my head now to attract a different clientele than I ever thought before. Where you can really, we can all have an impact pre-pregnancy, during pregnancy, and postpartum. That's a long time. That's like a year that you could potentially have a client. Obviously, you're not seeing them every week necessarily for all those periods, but it's really cool to have comprehensive, really holistic in the fullest sense of the word care.
Absolutely.
Um,
That can really create waves outward. Like,
mhm.
we talk about postpartum depression often,
Yeah.
and that really does, what the assimilating back, chemically, hormonally, physically, emotionally, to just you as an entity before pregnancy, is a huge journey. And so part of the whole postpartum depression, postpartum baby blues, postpartum psychosis, like there's so many different things that birthers can go through emotionally and mentally after having a baby. And having somebody care for them, even if it's for an hour, bi-weekly or whatever it is that's right for them, that can really just, again, it's invaluable.
Right.
That might be the only time that they put aside for themselves in the month.
Yeah, well, I think from this conversation, and we're going to bring it to a close, even though there's so much more I want to ask, but I have to limit the time because of fate of where I post it and et cetera. We can always have a series. We can have a series of three and do it on this, that, and the other thing. This is kind of an introduction. Um, but I see you as an important part of what I call the referral network. I always encourage everyone in our fascial stretch therapy family to develop your network of practitioners who do not do what you do and that you could really use as a referral for any of your clients who need that service. So for you, I think people in the Toronto area now have a doula that can advise them, the practitioner, and their client pre-pregnancy, during the term pregnancy, and then postpartum. So I'm going to encourage you guys out there in the FST family to do that, to refer to Hilary Boucher in Toronto if you're around that area. And I think it would be good to reach out to any other doulas in our network. Maybe I know there's at least one. She's in Arizona. I forgot her name. Sorry. And there may be others. So this could start something kind of cool. Maybe a doula forum, a doula special interest group. I don't know.
Totally.
But yeah, I think maybe we can summarize that. Maybe we can create like a little guideline thing, you and I, where we can summarize the kinds of things that we talked about. Just nothing too complicated, kind of simple, the stages to think about and how we can maybe educate our clients or patients and get them in to see us so they can actually have less issues during a wonderful time of their life.
Yeah, well said.
Well, thank you. So, to give you people a chance to find you, can you just let us know where you'd prefer to be contacted and how we can do that?
Yeah, so I can provide my email. So my email is info at Hilary Boucher, and Hilary is spelled with one L. Boucher, Boucher, bodywork, .com. So info at hillaryboucherbodywork.com.
Perfect. Thank you so much, Hillary. Please stay on the line, as they say, because I want to talk to you after we end this. So I just want to say thank you so much for spending the time with us, educating us. And now I know a lot more about a topic that I always wondered about. I have always given general guidelines to people, and we talk about it in our Facebook group. But now I feel more empowered, and I hope you do too, listeners. So if you need any more information, you know where to reach Hillary. And with that, I'll just say in America, I'm going to say to you guys, happy Thanksgiving. That's tomorrow. To others, and to others, to all a good night.
Bye, thank you.
Thank you.